Hello to Nursing 335 students. Dr. Hastings here. Hope all are good. This is my introduction narrative to Module 7. If you notice in the pacing document, I only put down pages 324 to 325 of Chapter 22, partly because I thought of it as more of a lead-in to Chapter 24, in all fairness, workplace violence. Now, there is a component several pages later about the impaired nurse in the chapter. It was such a quick read. The whole chapter is a quick read. I really thought that the other links on the module, including the readings that are in the discussion assignment, the impaired nurse assignment, were sufficient to cover that. But I'll just mention the whole chapter is fine. I just limited the page allocation a little bit to help you guys feel not so much that there was too many things going on, because there are a number of links, no question about it. Now, relative to, again, the module and the assignment, so here's the impaired nurse discussion board, and that's all set up. Remember, it has an extra day next week to flip over the holiday. This has several different readings. There's the law for nursing, but then there's these three articles that pertain to a link here, a link here, a link here, and then they're pretty basic. They're pretty easy. One is the impaired nurse per American Nurse Today, which is a peer-reviewed journal through the ANA, but of course it is a very light journal, I think, as people know. But I think the content here and the message is good. Then in addition to that, there are two PDF articles that I'd like to bring you to. One by Dunn is this home study program. A little bit dated, 2005. It actually really does a nice job with this in terms of the context. And then being able to address colleagues. I thought this was a little bit more powerful relative to a journal submission in the Journal of Nursing Regulations. So thinking about laws and policies that govern this, and how would you address this? Because of course you're thinking about, what do we do, especially as a leader or as a manager moving forward? What would I do to address that problem? We think how difficult it is with peers, and in fact, it's all about our ethical duty, to do the right thing to protect the public ultimately, and to get our peers some help. So in all this, those are the articles that support the discussion, and I think it's worthy of us to look at those quick reads and help that inform the discussion as we move forward, in effect, then too, and then the questions that flow from that, in effect, then too. So all right. To the point of the topic then too, in its entirety, so disruptive staff problems, impaired nurse is one, and we're highlighting that. And I think Chapter 24 with the theme in terms of preventing workplace violence is big, but I mean, this does at least highlight the basics. And it does refer to a serious problem in nursing that I think we all can identify with, which is certainly bullying and horizontal violence. That's not inclusive in our discussion moving forward, but it would be great to have some commentary on that, I would say, because I think we've all experienced it. I think we've all been, let's say, victimized to it, and incivility is a problem systemically on units. So I was tempted to create a ungraded discussion for this, but you've got enough on your plate. Plus other things coming up. I know the scholarly paper and the RN portfolio, to which you may have already seen that I had put up in the RN portfolio section on the course page, a brief overview of a binder that I have, one of the archived examples. But anyway, back to this topic. I look forward to a lively discussion here relative to themes associated with these problems that we're addressing this week, but let's focus it here on the employee with substance abuse. So I kept the PowerPoint in its entirety regardless of the page numbers I had on the pacing document, because I think this is really important that we can cover this and understand the nature of it. And the book does, in its few pages and the few slides here, do a nice job in terms of highlighting some of the key things we would be looking for in terms of the assessment part. does refer to state boards of nursing. We're going to refer to Pennsylvania, obviously, in the response in the link that was provided on the Impaired Nurse discussion assignment content page. So all this, we're thinking about with best of intentions, a peer getting some help and trying to become recovered relative to this kind of problem that's so systemic in our nursing culture. So I want to offer a few perspectives on that and to help guide you to consider not just the assessment piece, but what are the interventions that we could do to help. In effect, one of our peers, one of the folks in our ranks, become recovered, become safe again, earn their way back into the provider realm. We have to take that very seriously, certainly from the standpoint of even being a parallel peer in the treatment unit, but certainly with our leadership and management lens on, think about how we need to effectively engage one of our employees, one of our staff who's struggling, and how can we help them? How can the unit as a whole support a culture of help versus blame? It's difficult. It's a difficult situation. Individuals who have their license suspended relative to this are in effect losing their livelihood for a period of time, and they can earn it back, of course, through the different types of programs that state boards offer to do that, and certainly look at that content as I've posted on the Module 7 page. But the ridicule that they suffer relative to being known within the facility, within the unit, and to having, relative to reentry, go through a lot of, I'll just say, stigma and discrimination probably relative to their situation. So this careful planning theme with respect to reentry is really important, and the nature of our trying to modify our attitudes about this situation. So it is important. It is a critical consideration for us to recognize the need that even in our ranks we need help, that we struggle. We are human, and we do make errors in judgment, and we do go down patterns of difficulty with the disease process relative to substance abuse. And this is a triggered problem. This is a situation that demands our full attention, and not just because of the opioid crisis going on around us, but to recognize that within our own realm that we have individuals who are fully human and fully struggling and need our support. So I look forward to the discussion clearly, on this topic, and I hope everybody's vested in that process and has some anecdotes relative to this. So, all right, well, thank you for your attention. I will see you online.